Are you struggling with unexplained changes in your skin? What if these changes are warning signs of something much more serious, like kidney failure? Your skin could be telling you something vital about your health. Chronic kidney disease, CKD, is a silent, progressive condition that affects millions of people worldwide. While many are aware of the more common symptoms, such as fatigue and changes in urination, few realize that the skin can also reveal critical clues about your kidney health. From dry, itchy patches to unusual discoloration, these skin symptoms might be the early warning signs of CKD that you shouldn't ignore. In this video, we'll uncover the key skin symptoms associated with chronic kidney disease and explain why recognizing these signs early can be life-saving. By understanding these symptoms, you'll be better equipped to take action and protect your health before it's too late. Stay tuned to learn how your skin might be the first indicator that your kidneys need urgent attention. Understanding chronic kidney disease. Chronic kidney disease is a long-term condition where the kidneys gradually lose their ability to function properly. The kidneys play a crucial role in filtering waste products and excess fluids from the blood, which are then excreted as urine. When CKD develops, the kidney's ability to filter wastes diminishes over time, leading to a dangerous buildup of toxins in the body. This condition is often progressive, meaning it can worsen over months or years if not managed appropriately. CKD is commonly caused by conditions such as diabetes and high blood pressure, but it can also result from other factors like recurrent kidney infections, inherited diseases, or prolonged use of certain medications. General symptoms of CKD include fatigue, changes in urination patterns, swelling in the legs and ankles, and persistent itching. However, because these symptoms can be subtle and develop slowly, CKD often goes unnoticed until it reaches more advanced stages. Early detection of CKD is crucial because it allows for timely intervention, which can slow the progression of the disease, prevent complications, and improve quality of life. Regular checkups, blood tests, and monitoring of kidney function can catch CKD in its early stages, enabling better management and reducing the risk of kidney failure. How CKD affects the skin. Chronic kidney disease significantly impacts skin health due to the kidney's declining ability to filter waste and excess fluids from the blood. When the kidneys fail to function properly, toxins and other harmful substances build up in the body, leading to various skin issues. The skin, being the body's largest organ, often becomes one of the first places where these problems manifest. As kidney function deteriorates, the accumulation of uremic toxins in the bloodstream can lead to skin-related symptoms. These toxins irritate the skin, causing dryness, itching, and other discomforts. Major skin signs of chronic kidney disease. Dry and itchy skin, uremic pruritus. Dry and itchy skin, uremic pruritus, is a common and often distressing symptom of chronic kidney disease, CKD. As kidney function declines, the body's ability to filter waste products, including urea, diminishes. This results in the accumulation of toxins in the bloodstream, a condition known as uremia. One of the ways the body reacts to these elevated toxin levels is through changes in the skin. Impaired kidney function leads to a buildup of waste products in the blood, which can irritate the skin. This irritation manifests as dryness, flakiness, and persistent itching. The skin may become rough and scaly, particularly on the back, arms, and legs. The itching can be severe, often worsening at night, and can significantly impact the quality of life, leading to sleep disturbances and increased stress. The accumulation of urea and other toxins in the bloodstream is the primary cause of uremic pruritus. When the kidneys are no longer able to efficiently remove these substances, they circulate in the body and can deposit in the skin. This buildup causes inflammation and irritation, leading to the characteristic dryness and intense itching. Addressing this symptom requires managing the underlying CKD, potentially through treatments like dialysis, which can help reduce toxin levels in the blood. Darkened or discolored skin. Darkened or discolored skin is another skin manifestation of chronic kidney disease. As the disease progresses, some individuals may notice changes in their skin color, such as hyperpigmentation or a yellow-brown tint. CKD can lead to the skin becoming darker or developing a yellow-brown tint, a condition often referred to as hyperpigmentation. This discoloration is most noticeable on areas exposed to the sun, such as the face, neck, and hands. It can give the skin a dull, uneven appearance, which may cause concern or discomfort for those affected. The buildup of uremic toxins in the bloodstream is a key factor in skin discoloration. As kidney function declines, these toxins accumulate and can deposit in the skin, leading to the yellowish hue. Additionally, CKD often leads to anemia, a condition where the body has fewer red blood cells. Anemia reduces oxygen supply to the skin, contributing to a pale or ashen appearance. The combination of uremic toxins and anemia disrupts the normal pigmentation of the skin, resulting in the darkened or discolored patches often seen in individuals with advanced CKD. Addressing these symptoms typically involves managing the underlying kidney disease and correcting anemia, often through treatments like dialysis or medication. Swollen and puffy skin. Swollen and puffy skin is a common symptom of chronic kidney disease and can be particularly noticeable in the face, hands, and feet. In CKD, the kidneys lose their ability to efficiently remove excess fluids from the body. This impaired function leads to fluid retention, which accumulates in various tissues and causes noticeable swelling or puffiness. The swelling, known as edema, is most often seen in areas like the face, around the eyes, and in the hands and feet. It can cause discomfort, tightness, and a feeling of heaviness, particularly in the legs. The kidneys play a crucial role in maintaining the body's fluid balance. When they are no longer able to filter and remove excess water, this fluid accumulates in the tissues. The inability to regulate salt and water balance leads to an increase in the volume of fluid circulating in the blood, which then leaks into the surrounding tissues, causing swelling. Edema is a clear sign that the kidneys are struggling to perform their essential functions, and it often indicates that the disease is progressing. Managing this symptom typically involves dietary adjustments, such as reducing salt intake, and medical treatments to help remove the excess fluid from the body. Rash or blisters. Rash or blisters are skin symptoms that some patients with chronic kidney disease may experience, particularly as the disease advances. CKD can lead to the development of rashes, sores, or even blisters on the skin. These skin issues can appear suddenly and may be painful or itchy. The rashes often present as red, inflamed patches, while the blisters can form fluid-filled bumps that may burst and scab over. These symptoms are more than just surface-level irritations. They can indicate a deeper issue related to kidney function. The appearance of rashes or blisters in CKD patients is typically linked to the buildup of uremic toxins in the bloodstream, a condition known as uremia. When the kidneys fail to filter out these toxins effectively, they accumulate and can cause significant irritation to the skin. In severe cases, the toxins can lead to inflammation and damage the skin's surface, resulting in rashes, sores, or blisters. Additionally, CKD can weaken the immune system, making the skin more vulnerable to infections that can cause or exacerbate these conditions. Managing these symptoms requires treating the underlying kidney disease and may involve therapies to reduce toxin levels in the blood, such as dialysis, as well as topical treatments to soothe and heal the skin. Pallor, pale skin. Pallor, pale skin, is a common sign in individuals with chronic kidney disease, often associated with the condition's impact on blood health. Pallor, or an unusually pale skin tone, can be an early indicator of kidney failure. This paleness is typically most noticeable in the face, lips, and nail beds. It occurs because CKD often leads to anemia, a condition where the body has fewer red blood cells than normal. These cells are responsible for carrying oxygen throughout the body, and when their numbers are low, the skin can appear lighter or more washed out than usual. The kidneys play a crucial role in producing erythropoietin, a hormone that stimulates the bone marrow to produce red blood cells. In CKD, damaged kidneys produce less erythropoietin, leading to a decrease in red blood cell production. This reduction in red blood cells causes anemia, which in turn leads to the characteristic pallor seen in CKD patients. Anemia also contributes to other symptoms like fatigue and weakness, making it a significant concern for those with kidney disease. Treating this aspect of CKD may involve medications to boost red blood cell production and managing the underlying kidney condition to prevent further deterioration. Other related symptoms. Other related symptoms of chronic kidney disease can include noticeable changes in the nails and hair, which are often overlooked but can be important indicators of declining kidney function. Nail changes. One of the distinctive signs associated with CKD is the development of half-and-half nails, also known as Lindsay's nails. This condition is characterized by the nails appearing white or light-colored at the base, proximal half, and brown or reddish at the tip, distal half. This color change is thought to result from the buildup of uremic toxins in the body, which affects the nail beds and disrupts normal pigmentation. Additionally, nails may become brittle, ridged, or prone to breaking, reflecting the body's overall struggle to maintain healthy tissues due to impaired kidney function. Hair loss. Thinning hair or hair loss is another symptom that can be linked to CKD. As the kidneys fail, the body's overall health deteriorates, and the lack of essential nutrients and the buildup of toxins can negatively impact hair follicles. This leads to hair becoming thinner, more fragile, and prone to falling out. Hair loss in CKD patients is often gradual, but it can become more noticeable as the disease progresses and the body's nutritional status declines further. Managing these symptoms requires addressing the underlying CKD and ensuring proper nutrition and care for the hair and nails. When to see a doctor. Importance of medical consultation. If you notice any of the skin symptoms discussed, such as persistent itching, darkened or discolored patches, swelling, rashes, or changes in your nails and hair, it's crucial to consult a healthcare provider. These signs, especially when accompanied by other symptoms of chronic kidney disease, CKD, like fatigue, changes in urination, or unexplained weight loss, could indicate that your kidneys are not functioning properly. Early detection is key in managing CKD effectively, as catching the disease in its early stages can prevent further damage and improve your quality of life. Diagnosis and treatment. CKD is typically diagnosed through a combination of blood tests, urine tests, and imaging studies that assess kidney function. Blood tests, such as measuring creatinine levels and estimating glomerular filtration rate, GFR, can indicate how well your kidneys are filtering waste. Urine tests can reveal the presence of protein or blood, which are signs of kidney damage. If CKD is diagnosed, treatment usually involves managing underlying conditions like diabetes or hypertension, making lifestyle changes, and in advanced cases, dialysis or a kidney transplant. Consulting a doctor early ensures that you receive the appropriate care and can slow the progression of the disease. Preventive measures and lifestyle tips. Healthy diet. Maintaining a kidney-friendly diet is crucial for preserving kidney health and preventing the progression of chronic kidney disease. A kidney-friendly diet typically includes reducing salt intake to lower blood pressure and decrease the workload on the kidneys. It's also important to limit protein consumption, as too much protein can strain the kidneys. Focus on eating fresh fruits and vegetables, whole grains, and healthy fats, while avoiding processed foods high in sodium and unhealthy fats. Staying hydrated is essential, but those with CKD should monitor fluid intake based on their doctor's advice. Regular checkups, regular health screenings are vital, especially for individuals at higher risk of CKD, such as those with diabetes, high blood pressure, or a family history of kidney disease. Regular checkups allow for early detection of kidney issues before they progress to more severe stages. Monitoring kidney function through blood and urine tests can catch early signs of CKD, enabling timely intervention. Skin care tips. Managing skin symptoms at home involves using gentle, fragrance-free moisturizers to combat dryness and itching. It's also important to avoid harsh soaps and detergents that can further irritate the skin. Opt for mild, hypoallergenic products, and consider taking lukewarm showers instead of hot ones, as hot water can strip the skin of its natural oils. Keeping the skin hydrated and protected can help alleviate some of the discomfort associated with CKD-related skin issues. Our skin can be a window into your overall health, and changes in your skin might be more than just cosmetic concerns. They could be early signs of something more serious, like chronic kidney disease. It's essential to pay attention to any unusual skin symptoms, such as persistent itching, discoloration, or swelling, especially if they are accompanied by other signs like fatigue or changes in urination. Early detection and treatment of CKD can make a significant difference in managing the condition and preventing further complications. If you notice any of these symptoms, don't hesitate to seek medical advice. If you found this information helpful, please give this video a thumbs up and share it with others who might benefit from it. Don't forget to subscribe to our channel for more valuable health-related content, and hit the notification bell to stay updated with our latest videos. Your health matters, so stay informed.